disadvantage for themselves in terms of their thinking and memory abilities.
I didn't start marijuana thinking I was ever going to get addicted to it.
Marijuana is the most common illicit drug in the United States. One recent study found that about 42% of teens will have tried it before they graduate from high school.
There are lots of reasons why students might want to experiment with pot. Some want to fit in with their friends or to look cool. Some are curious, and many think that smoking pot isn't a big deal, or that it isn't unhealthy or dangerous.
But recent research indicates that using marijuana can have a variety of negative effects. Smoking pot can impair your brain's ability to organize new information, to remember things, and to learn.
Marijuana affects coordination and judgment. Among other things, it increases your risk of being involved in a car crash.
Pot makes you more likely to suffer mental and physical health problems. And contrary to what some think, marijuana can be addictive.
In this 22-minute program, we're going to look at these risks and more. Let's get started with what draws people to marijuana in the first place, the marijuana high.
Marijuana comes from the leaves of the cannabis plant, and it's usually smoked in a joint or a bong. It contains psychoactive compounds that change the way your mind perceives and processes information.
People use marijuana because, like with many other drugs of abuse, it makes you feel high. That is, smoking marijuana makes you feel good, at least at first.
Users report feeling happy or relaxed after smoking marijuana. They might also experience sensory disruption and feel hungry.
I don't know how to describe it. Just, I could say groggy, lightheaded.
You just get this feeling of, like relaxation, like your body, you just feel mellow, you feel really calm.
All of those effects can be traced back to one chemical, delta-9 tetrahydrocannabinol, or THC. THC is the most powerful ingredient in marijuana. When someone smokes, THC passes from the lungs into the bloodstream, where it is carried to the brain. Once there, the chemical attaches to special sites on nerve cells called cannabinoid receptors.
Some parts of the brain have few or none of these receptors. Other parts have a lot. The more receptors that THC can bind to, the more it will affect that part of the brain. It turns out that the parts of the brain most affected by marijuana are also in charge of some major functions.
Marijuana affects how coordinated you are, everything from playing sports to walking down the street. It affects how well you're able to learn new information in class or study for a test. And it also affects your judgment. That is, your ability to make smart decisions.
The more THC in marijuana, the more dramatic these effects can be. That's a problem because the amount of THC found in marijuana has doubled in the past 20 years. Because marijuana isn't regulated, there's no way to know just how much THC you're getting.
So although many people think, well, if it's stronger, I'll smoke less. Well, that's good in theory, but what actually happens is that the peak of pleasure, if you will, is higher from the stronger pot. So unfortunately, the downside of smoking, the pot withdrawal, if you will actually be deeper.
Let's take a closer look at some vitally important functions of the brain that can be impaired when someone smokes marijuana: learning and memory. Studies have shown that THC impairs thinking, reading comprehension, and verbal and math skills.
Scientists who study marijuana are beginning to understand just how the drug changes your ability to think. Dr. Susan Tapert is one such researcher at the University of California, San Diego.
There are several different brain areas that seem to be a little bit more affected by the high of marijuana, and that's kind of the frontal lobes where we're making decisions and using our judgment, hopefully. The cerebellum, which has to do with balance and coordination. The hippocampus, which has to do with learning new information, and so people often who are under the influence of marijuana aren't able to learn the details of new information very well.
Smoking marijuana harms our ability to learn because it causes the brain to work differently. In fact, the brains of young people who use marijuana have to work a lot harder to do things that should be easy. Dr. Deborah Yergelin-Todd of McLean Hospital in Belmont, Massachusetts, is another researcher who studies how marijuana affects the brain.
This is the frontal cortex, and it's this part of the brain, this frontal cortex, that is most affected by smoking marijuana. Those yellow parts right there are showing the amount of blood flow or the amount of activation when you're doing certain things with the brain. And that activation is very normal and very typical for healthy individuals. When a marijuana user activates, what we're seeing is a loss of activation or reduction in activation here in the cingulate. But what we see also is an increase in activation out here on the edges, what we call the lateral part of the brain.
In other words, the parts of the brain that you're supposed to be using aren't doing their jobs, so you're having to use other parts to make up for the loss.
Their brain activation pattern is different, and that's what makes us concerned for them, because their brain has to work harder to get the same kind of an effect. In school, this would mean that you would have to work harder. You kind of have to really pay attention and use all your mental effort to do the same things that somebody else who's not using pot could do without having to work as hard. So I want young people to understand that they may be making a disadvantage for themselves in terms of their thinking and memory abilities.
The big thing was my grades definitely dropped.
It made me less motivated.
When I was in high school, I failed my sophomore and junior years in high school, so I just didn't care about my work.
Marijuana affects more than the brain's ability to learn and remember. Because pot affects balance, perception, coordination, and reaction time, it puts you at risk of serious injury and even death, particularly if you drive. Here are some facts. Teens are just as likely to drive under the influence of marijuana as alcohol. And a recent study has shown that smoking pot within 3 hours of driving nearly doubles the risk of crashing.
Marijuana is the big hurdle for us still. People look at it as a recreational drug and not that dangerous.
It does affect the brain. It affects your response to various stimuli. It alters your perception of time and space, which obviously if you're driving a vehicle could be a problem.
The perception of distance is actually impaired. For example, we're predatory by nature, 2 eyes, 1 target. I can look at my finger and I know I can reach out and touch it just like that. Because my 2 eyes are focused on 1 point, triangulation, I know how to get to that point. Marijuana actually prevents people from being able to converge their eyes. For the most part, every time somebody has like a convergence, they're perceiving an object further away than what it actually is.
Say you were driving a car and someone pulled out in front of you. Your reaction time and perception might be slowed down, which would ultimately affect your ability to control the vehicle.
It alters the perception of what you can do, and it may heighten your perceived abilities far beyond what you're capable of doing.
Your ideas of self-perception and self-limitation are tremendously altered, and they have tested these and looked at response times, and marijuana does definitely affect a person's ability to properly control a vehicle.
Marijuana may give them confidence that they really don't deserve having.
Car crashes are one example of the ways marijuana can affect how we function both physically and mentally. Let's take a look at some other mental risks. Some studies have found a link between marijuana and mental problems such as depression, anxiety, and even suicidal thoughts. Pot may also pose a risk to people who are genetically vulnerable to schizophrenia.
For these people, using marijuana as a teen may make it more likely that they'll struggle with a mental disorder later in life.
One of the bad potential side effects of the stronger pot, and I've certainly seen it in my practice, is that small subset of people who will actually become psychotic and have an ongoing psychotic disorder from using the pot. So if you're prone or have a family history of schizophrenia, bipolar disorder, certainly any depression or anxiety, smoking pot is going to make it more likely that those problems affect your life in a negative way.
Scientists have a lot to learn about how pot affects mental health. We know that it involves a complex interaction between the drug, a person's genetic makeup, and the environment.
We're learning more, just as we're learning more about the risks to physical health.
Some of the physical effects of marijuana are well documented. Take the heart. Shortly after smoking, pot increases heart rate by 20 to 100%. The effect can last up to 3 hours. Marijuana can also affect heart rhythms, causing palpitations and arrhythmias. One study indicated that marijuana users have a 4.8-fold increase in the risk of heart attack in the first hour after smoking the drug.
What about the lungs? We all know that tobacco smoking is a major cause of lung cancer and other cancers as well. Does marijuana have a similar effect? Well, the truth is, we don't yet know for sure. There's a lot of debate about this. But this much we do know. Marijuana contains many of the same chemicals associated with cancer that are found in tobacco.
The chemicals that may cause cancer that are in tobacco cigarettes are actually in marijuana cigarettes. They're part of the leaf and the stems and the buds that are used to put in a marijuana cigarette.
Here's something else. Marijuana users inhale the smoke more deeply and hold their breath longer than tobacco smokers.
And while we don't yet have proof that smoking pot can increase the risk of various cancers, we do know that marijuana smokers can have many of the same respiratory problems as tobacco smokers, including persistent cough and phlegm production, more frequent acute chest illness, and a heightened risk of lung infections. Take a look at the difference between the healthy lungs of someone who doesn't smoke pot and the lungs of someone who does.
This is what we see in someone who's a non-smoker, someone who doesn't smoke tobacco or marijuana cigarettes. And we see the tissue that lines the breathing passages is kind of usually a pinkish color like the inside of your cheek. These are the same kinds of pictures from someone who has smoked marijuana. We see it's very red, swollen. Some of the blood vessels are sticking out and very irritated in the lung. One of the tubes that we can see where it branches into this breathing passage is completely blocked off. It's swollen shut because of the irritation caused by the smoke.
While we're talking about health risks, we've got to bring up something else. That's the risk of using spice or K2, an artificial form of marijuana. The drug spice or K2 is like marijuana, but much stronger. It contains a synthetic form of THC.
The spice has been around for a number of years. Essentially in the mid-90s, a researcher was looking for a way to create a medicine-type drug for cancer victims. The THC, or the active component ingredient in marijuana, is what the researcher was attempting to mimic with the development of what we call synthetic cannabinoids.
What he discovered was, while he was trying to find this medicine, was something that was so strong, it mirrored the THC, but it was 500 to 700 times stronger, and it would have not been useful as a medication.
He's created something that binds even more tightly and can be even more concerning with regard to the impact on your brain.
When I first smoked spice, I was extremely high and extremely sick.
The effects are much greater than weed being bad enough as it is.
Some folks experience nausea, disorientation, increased heart rate, paranoia.
not a pleasant experience.
We had the hospitals, Idaho Hospitals Association, do a quick survey of hospitals, and 20 responded, and in a 6-month period had over 80 emergency room visits where the hospital could identify this is because of spice.
We've seen a couple of patients come to the emergency department in the last couple of weeks with the adverse effects of spice or K2.
I hated being on it because of the way it made my stomach feel, seeing things, the not wanting to move.
You really feel like you're dying, like your heart starts beating really fast. Look in the mirror and your face is really pale. I started to know what the effects were, but something in me just like I couldn't really stop using it because I'd go like an addiction to it.
They say you can't be addicted to it, but man, I've had some days when it was just like I needed marijuana for me to function.
It's common to hear people say that marijuana is not addictive, but the research and the stories of users themselves paint a different picture.
Like other drugs, marijuana affects the brain in several ways. The more marijuana a person smokes, the more his or her brain adapts to the presence of the drug. The person has to use more in order to get the same effect, or the same high. That's called tolerance.
And this is one of the hard parts about recovery from pot, for especially a heavy user. Nothing is exciting anymore. Nothing has the same amount of pleasure that it used to have before the pot. And everyone would say, well, the only thing that makes me happy is the pot.
When you've been smoking pot for a while, it definitely starts to get a little boring, which is probably why people start smoking more and more, because they want to get higher because it starts to be bored to them.
Marijuana, like all drugs of abuse, eventually affects your ability to feel pleasure at all. When you feel good about something like winning a game or getting an A on a test, it's because part of your brain is releasing a chemical called dopamine. But marijuana hijacks that part of the brain, making it difficult to feel pleasure from anything other than, well, marijuana.
Some users also become physically dependent on the drug. They will experience physical withdrawal symptoms when they stop smoking marijuana. These can include irritability, trouble sleeping, anxiety, depression, and lack of appetite. These effects can last from a few days to a week.
After a while, for some users, their ability to exert self-control can become seriously impaired. While the initial decision to take marijuana is mostly voluntary, when addiction takes over, a person's use becomes compulsive and involuntary. Addiction is considered a brain disease because drug use has caused changes in the brain that can be long-lasting.
I feel I was very addicted to marijuana. It was escape, and that was the only way I could truly find an escape in life. Started all little, maybe like one bowl a day, and kept getting it more and more, where I was smoking constantly throughout the entire day, and using different paraphernalia and trying different things out.
So I didn't start marijuana thinking I was ever going to get addicted to it. No, I really can't say that. I started marijuana because I thought it was fun.
Not everybody who tries marijuana will get addicted to it, but there's no way of knowing if you'll be the person who develops a real problem. Statistics show that if you start smoking pot in your teen years, you significantly increase your risk of getting addicted.
And this can have a significant impact on other aspects of your life. Institute of Drug Abuse, someone who smokes marijuana daily could be operating on a reduced intellectual level all the time.
Marijuana puts you at a disadvantage right when you most need all of your judgment to make good choices and get ahead in life.
People who stay stoned all the time form a group. So you sort of step back from your peer group, the people who are moving forward, and you all are just stagnating here, stoned.
And don't forget, recreational use of marijuana is illegal. Getting caught can land you in jail. It can get you a big fine. It'll be on your record. And that's not going to look good when you want to apply to college.
And what about a job? Many employers require drug tests to be hired or to continue working. Failing a drug test can get you fired. All of these things can just be the start of your problems.
You may have heard marijuana called a gateway drug. Not everyone who smokes pot will move on to harder drugs, but most people who get hooked on drugs like heroin or cocaine started out with just marijuana.
In the beginning, I could smoke one joint. After, it'd be like an eighth would do me, justice for the day, I really found that I had to progress with marijuana. I think that's also why it triggered me to try other drugs.
The problem with it as you start moving up the drug chain is these drugs are more powerful, have much more profound effects on the body and the brain, and are much, much more addictive potential.
Do you or a friend have difficulty controlling how much marijuana you use? Are you unable to stop even though your drug use has caused problems in your life?
Quitting marijuana when you're addicted can be really tough, but help is out there. Talk to a trusted adult who can help you find the support you need to stop. A family doctor is a great resource who can point you to substance abuse counseling or group support for treatment.
More teenagers enter treatment each year for marijuana dependence than for all other illegal drugs combined. But with counseling and treatment, many of them succeed in getting off the drug and moving on with their lives.
There is one easy way to avoid all the problems associated with marijuana, though, and that's to not start in the first place.
So there you have it, 22 minutes worth of the information you need to know about marijuana. Thanks to the active ingredient THC, marijuana causes problems with learning and memory.
It can also increase the risk of serious mental health problems ranging from depression to anxiety to schizophrenia, and many physical problems as well, including heart and respiratory issues.
Artificial marijuana such as spice or K2 are particularly dangerous because of the high concentration of a synthetic form of THC.
Contrary to what many people think, there is a significant risk of becoming addicted to marijuana.
All these things pose serious risks for your future and goals in life.
If you thought that smoking pot wasn't such a big deal, we hope you think again.
And we hope these 22 minutes will get you thinking about your own decisions regarding marijuana.
Alright, so sorry I turned off my video just because I thought it was a little distracting. However, I really like that. I know it's a little bit cheesy at times, but it's a good video. I won't go through all of it because I want to talk about the legality of it real quick.